The government has pledged to immediately settle all pending hospital claims of 10 million Kenyan shillings and below from the defunct NHIF, aiming to ease the ongoing healthcare crisis. President William Ruto, in a State House statement, acknowledged inheriting a 33 billion Kenyan shillings NHIF debt and assured that hospitals with larger claims would undergo a 90-day verification process before payment. He also announced the formation of a verification committee and reaffirmed the government's commitment to universal healthcare coverage, noting that 18.2 billion Kenyan shillings had already been disbursed for undisputed claims under the Social Health Authority. Our reporter Florence Simiyu with more to that story.
President William Ruto directed the immediate payment of hospital debts up to 10 million Kenyan shillings, previously owed by the defunct NHIF, to address the healthcare crisis. He acknowledged inheriting 33 billion Kenyan shillings NHIF debt, which has severely affected healthcare services under SHA. He noted that this had a devastating effect on the provision of healthcare in the public, faith-based and private hospitals. He outlined a payment plan ensuring that 91% of hospitals contracted by NHIF would receive full payments immediately. For hospitals with claims exceeding 10 million shillings, he stated that the verification would take 90 days before determining a payment plan. He also announced the formation of a verification committee within a week and assured that SHA would settle all current claims within a month. He disclosed that to date, the authority has disbursed 18.2 billion Kenyan shillings for undisputed claims lodged between October 1st, 2024 and January 31st, 2025. Reaffirming the government's commitment to the universal health coverage, he emphasized that the government is fully committed to providing universal health coverage to every Kenyan without discrimination. In an effort to address long-standing challenges in the healthcare system, Health Cabinet Secretary Deborah Barasa has announced expanded benefits under the Social Health Authority. In a recent statement, CS Barasa revealed that the government has significantly increased coverage for high dependency units and intensive care units, raising the capacity from 4,600 to 28,000.
Emergency, chronic and critical illness funds. As you have heard, we are now increasing the amount to 28,000 for the critical care management, and we'll keep reviewing the benefit tariff package to ensure that it is addressing the concerns of Kenyans and that Kenyans are receiving quality services.
The revised benefits also include an enhanced oncology care package, with household coverage increasing from 400,000 to 550,000 to make cancer treatments more accessible. To improve patient care coordination across multiple hospitals, the ministry plans to integrate 15 high-volume facilities into the healthcare information exchange system, enabling seamless data sharing.
I've also tasked the team to look at the scope of practice for each healthcare worker, whether it's the nurses, the clinical officers, all the cadres across the country. That way, we can be able to see what are they eligible to do in terms of procedures and skills, and they're able to offer quality care services to all patients and ensure that all Kenyans are safe when undergoing these procedures.
Additionally, a 24-hour call center will be established to provide real-time support for patients and healthcare providers. The ministry reports that over 500,000 Kenyans have already benefited from SHA, with more than 18 million successfully registered. Reporting for Tandao News Outlook at 1, I'm Florence Simiyu.